Dr. Colleen Fogarty, the chair for the University of Rochester Department of Family Medicine, is with us. Dr. Fogarty, so nice to have you. Thank you for joining us.
Good morning, Allie.
So we're talking pediatric COVID vaccines. Start by letting us know kind of where we stand for those vaccines for children under the age of 5.
Yes, in mid-June, both the FDA and the CDC recommended emergency use of the Pfizer and Moderna vaccines for children ages 6 months and up.
So these vaccines, relatively new. Tell me why they're so important for health.
Yes, young children, just like anybody else, can become infected with COVID. Sometimes they can get very sick with long-term complications and often can spread the infection to others. The more people that get immunity from the vaccine, the more we can slow down the spread of COVID and the harm it does to individuals and the community.
Now, one thing we've talked to many doctors about through this pandemic is side effects of these COVID vaccines. How about for these vaccines for children under 5? What are we seeing when it comes to side effects?
So the first thing to note is they're very safe. These vaccines have been used in adults for nearly 2 years and in older children and teens. Common effects are fever, sore arm, headache, or feeling tired. And these are actually the signs that the body is developing immunity, and they don't mean that your child is getting sick. They're the same vaccines as we've been using, but the smaller dose reflects the need for a smaller amount for a smaller person.
Kind of going off what you were just talking about, that smaller dose, how do these vaccines for children under 5 differ from vaccine for those maybe over 5, over 12 adults?
They're exactly the same composition. They're just a smaller dose, and that's been shown in studies that the immunity is adequate from a smaller dose and the side effects are fewer.
So if there's parents or guardians who are kind of on the fence about getting their kids who are under the age of 5 vaccinated with this COVID-19 vaccine, what would you say to them? Why should they get this vaccine?
The more protection that all of us have, the more we'll be able to stop the spread of COVID. And on an individual level, giving your child the maximum protection against infections that can be serious is really important. Even if the child has already had COVID, it's recommended to get the vaccine because it can add additional immunity for the next time the child may be exposed to COVID.
Great. Thank you, doctor. Last question for you. If someone is interested in getting their child vaccinated, how can they do so?
Okay, great. Lots of options. Local practices, pharmacies, and health department clinics are offering vaccines for this age group. Your child's primary care practice, you can contact them by their website, the patient portal, or phone to schedule.
Many options there. Dr. Fogarty, so nice to have you with us. Thank you for joining us. We'll also have a link to sign up for vaccines over at rochesterfirst.com.